In this video, we're going to summarise what we've covered so far on Consultations for Health. Welcome to Consultations for Health, helping you progress in your communication skills to optimise the care of your patients. After our short break, here's a chance to catch up on some of the videos you may have missed that we filmed previously. In our first video, What is a Consultation?, we explored which interactions could be considered a consultation. We came to the conclusion that any interaction between a healthcare professional, a patient or their representative, no matter how long, provides an opportunity to enhance the health of that patient and therefore can be considered a consultation. In our second video, we considered the important role of non-verbal communication in a consultation. Only 7% of communication is the words we say. The majority of the messages the patient will receive and the ones that you will receive from your patient come from the way they were saying it, the speed and tone of their voice, and their gestures, hand movements that indicate how they're truly feeling and thinking. It's therefore really important that healthcare professionals can monitor their patients' non-verbal communication to pick up on those true messages and be careful to moderate their own behaviour so as not to give inappropriate messages to their patients. We have then shot a series of videos breaking down different aspects of a consultation. We started with meeting and greeting and demonstrated how the skills you have developed when you first meet a person can be translated into the healthcare environment. That initial impression is fundamental to the success of the future consultation. Therefore, it's important you introduce yourself, hello, my name is, and make your role clear to the person. This should be done in a very friendly and enthusiastic way to create the best first impression. We then explored another essential part of starting a consultation, negotiating a shared agenda. Whether it be a consultation that the patient has initiated, i.e. by making an appointment to see you about a health concern that they have, or a practitioner initiated, calling in a patient for a medication review, for example, in both these situations it's important that both parties clarify exactly what they'd like to talk about and identify their initial concerns. This enables parties to agree the priority and order of things they will discuss during that consultation. We then shot two videos surrounding gathering a patient's history, using open and closed questions. Open questions open up a topic and enable you, the practitioner, to get richer information, particularly about how people may be thinking or feeling regarding the situation. Closed questions are useful to get specific pieces of information that may aid diagnosis or clarify situations for you. By using these questions together in a funneling approach from open to closed would be a sensible way to gather an effective patient history. In the active listening video, we explored how this essential skill can help build rapport and trust and ultimately an effective therapeutic relationship with your patient. We talked about the skills of paraphrasing, summarising, clarifying and reflecting. And by using these skills effectively throughout a history gathering consultation, you will be able to build rapport and trust with your patient and demonstrate that you have truly listened and understood what they have told you. We then explored summarising and clarifying in more detail, looking at how summarising information that the patient has told you is a really effective tool to enable them to add or change information they may have told you. And clarifying information is essential to ensure that you have truly understood what the patient has told you, particularly if they have used their own language that you may not be familiar with. We then moved on to thinking about giving information or providing information to your patients, and we looked at the skill of chunking and checking. Chunking and checking enables you to group together small chunks of information that should be easily digestible for the patient. Checking means that you give the patient an opportunity to actively demonstrate that they have understood what you have told them. Using these skills when providing information is essential to ensure the patient has understood and can take away the key messages from the consultation. As with all consultation skills, chunking and checking is not one size fits all. You will need to adjust your methods and techniques to be appropriate for the patient that you have in front of them to ensure you don't come across as patronising. We then looked at the end of a consultation and how you would close it effectively. Closing a consultation relies on everything that has gone before being effective and well managed. But there are some essential skills that you can use at this point. This includes forward planning, where you contract what you are going to do next and what the patient needs to do next, and safety netting to make sure you have a plan for when the plan doesn't work. You would then do your moving to the final points of closure with a final summary and final check. The MRCF video, or Medicines Related Consultation Framework, demonstrated how all the different consultation skills can be pulled together to help you develop in your consultations which are associated with medication. This could be used as a tool to help you train and develop and improve your consultation skills. For more information, why not watch these videos in full? Click on the video or follow the links below. And don't forget to contact us if you have any particular requests for videos or consultation examples that would help you develop in your consultation skills. We look forward to hearing from you and interacting with you over the next few months. Thank you for watching Consultations for Health. Don't forget to follow us on Twitter, like our Facebook page and subscribe to these videos.